So, hello everyone. We are back with Natalie Copeland-Traster. Is that how you say your
Yep,
second
you've
name?
got it.
Okay. Sorry, I didn't say it the first time. I wanted to make sure to say it the second time. This is our second part to our interview. Um, and let's just get started back into it.
All right.
Um, so the fifth question, how many people use substances as self-medication tactics for their mental health issues?
So this is kind of a tough question to answer. So people commonly report using substances, especially trying to cope with specific mental illnesses such as mood and anxiety disorders. And if you review the various scientific literature, one study reported that 22% of people with anxiety disorder, for example, reported self medicating with drugs and alcohol. And another study indicated that more than 21% of people with post traumatic stress disorder, or as it's commonly known as PTSD, had used alcohol or drugs to cope with their disorder. Along with approximately 23% of people with major depression and 41% of those with bipolar disorder, especially type 1. But self-medicating can occur even if somebody doesn't have a formal diagnosed mental health condition. Difficult life events, such as grief, abuse, trauma, can affect a person's mental health and lead people to turn to alcohol or drugs just to cope with those feelings. And grief results in increased substance use, according to an even more recent study. So, when someone's in an abusive relationship or has experienced some form of trauma, as a result, they're also at an increased risk of using substances to cope with their situation. And in fact, adolescents with a substance use disorder are 3 times more likely to have experienced a traumatic event than the average adolescent. And as we had talked about before, it's really important to note that the number of people that self medicate may never truly be known because it is incredibly underreported.
Mhm. Wow. Those numbers, again, like they're so shocking, honestly, to just when you put them in, statistics, they're so
When you
shocking to me.
quantify it when you
Yeah.
quantify it, it is astounding, but again, when you look at it, you know, it's much more common than people wanna talk about, which is why it is so important to normalize these conversations. You
Mhm.
know, talking about substance use disorder, mental health conditions, that should be as normal part of your conversation as Ohio's weather or, how somebody's doing, you
Yeah.
know?
And that's such a, it's, we kind of touch the surface with asking, each other how we are doing, but you always get like a surface level answer depending on who you talk to. Not really getting down to the problem itself, and that's just people being comfortable enough to share with their friends, like, hey, like I'm really doing poorly, but I'm going to tell you that I'm fine because, that's the polite thing to do. But just to normalize conversation, you could just say, I'm doing okay. And then, going further into it, I've been stressed, I've been dealing with so and so, just normalizing the flow of the conversation and not just getting to the surface level of it.
Yeah, and honestly, if you try to open up some of those conversations, you might be surprised at how many of those friends that you think are so happy and go lucky, have this perfect life, are also struggling too.
Mhm. Yeah. So with the sixth question, um, would self-medicating cause behavioral changes in a college student?
Oh, yes. Yes, it definitely would. So one before we kind of jump into that, it's important to know that um, the number of people that self-medicated during COVID definitely increased.
Okay.
Um, just within the first 2 weeks that Governor DeWine had shut down bars and restaurants, Ohioans purchased almost 500,000 gallons of liquor.
Wow.
This is just liquor. This isn't wine. This isn't beer. So that can kind of tell you how Ohioans, were sort of coping with
Mhm.
this uncertainty of the pandemic. And you can also, unfortunately, see the astronomically high rates of overdose deaths. Um, that are occurring here within the US. Basically, every 5 minutes, somebody's dying from an overdose. There's fentanyl and its analogs that are saturating the drug supply, as well as other factors that have occurred. And, some of the changes behaviorally that you might see, especially if somebody might be self-medicating, you might see some changes in mood. They might be exhibiting more anger, irritability. They might even be a little bit more withdrawn. There could be academic or behavioral problems that you might see, not just in a school setting, but out in your social settings as well. A bit of rebelliousness, maybe changing groups of friends, which with changing groups of friends, sometimes that just happens during various stages of life. But if you notice that somebody is just making these drastic changes of their peers and they're with, peers that you might be habitually engaging in substance use, that might be a sign. You might see kind of a lower energy level, maybe not as perky as they once were, a little bit less interest in some of their activities, or even the care that they might have had in their appearance before. Now, don't get me wrong. Some days, you just want to, toss on some yoga pants and just throw your hair back and get on with your day. But you might see, hygiene might not be what it used to be. Um, Especially when alcohol is concerned, you might even smell alcohol on somebody's breath. There might be some problems where with concentrating or remembering things, even slurred speech or a coordination problem as well.
I'm sorry. That is a lot of information,
Yes.
honestly. There's so many things you can just tell, and you would think like some of these things just happen, like you said, switching friend groups. That's a natural thing, but um, just like some of the other symptoms that aren't just normal, like slurred speech um, and things like that. That's just so interesting, just to see what behavioral changes, how just seeing that, those are the examples that you would you know look out for as a.
Well, and a lot of those symptoms are very, very close to mental health conditions. If somebody's like withdrawn, that they might be, suffering, from depression and whatnot. That same thing can be said, for, some of the hygiene things. And slurred speech and coordination, that could even be have a medical basis to it. So it's always important that if you are noticing these things, just try to have a conversation. Don't accuse, don't be very judgmental, don't just be like, okay, we checked off all these boxes, so this is definitely what's going on. There might be something else going on too. Certainly, individuals that have experienced trauma could also exhibit some of these situations. So when we talked a little bit earlier about if somebody's being diagnosed, you always have to rule out whether or not the symptoms that they're demonstrating are substance induced or trauma related. Again, people can exhibit different signs, differently. And also, polysubstance use, it has kind of become the norm. Are you familiar with what polysubstance use is?
No.
So that's when people are using multiple substances. So, for example, somebody that's might be, say, using opioids, they might use a stimulant to kind of offset some of the effects of the opioids, especially if they're sort of having like that sort of crash, they might use a stimulant so that they can just kind of maintain. Or you might see people that are using marijuana or other substances to kind of offset some of those side effects.
And it was interesting when you touched on that's as a professional having to diagnose someone, it must be difficult with the behavioral changes being so similar, because I know as a just a regular person just trying to self-diagnose, trying to figure out what's wrong with me personally, it's so difficult to do because some of the symptoms that you see or that you feel are so similar to maybe something else where you're just like, it could be this, it could be that. That's why it's always just good to just like, okay, something's wrong, just go talk to someone who is a professional and can figure it out instead of trying to
Yes,
self-diagnose. Yeah.
definitely, definitely, because it's along the lines of going on WebMD. Do you really want to sit there and go down that rabbit hole and diagnose yourself? It's probably better to seek a professional.
With our seventh question, what are some stigmas associated with a person, maybe specifically a college student, suffering from mental health issues?
So, mental health and substance use disorder, stigma, that typically occurs when a person begins to define another by their illness rather than who they are as an individual. So, someone might refer to somebody as psychotic, crazy, or a druggie or an addict, rather than a person with psychosis, a person with mental health condition, or a person with substance use disorder, for example. And one thing we do know is that stigma is the number one barrier to both treatment and recovery. And people may experience feelings of shame, hopelessness, as well as isolation. And they may be reluctant to ask for help or to seek treatment. Their family, friends, and or their support system might not understand what's actually going on with that individual. There may be barriers for employment, social interaction, health, education, housing, and much more. People may experience physical violence or harassment, and self doubt in being able to overcome your illness or just being able to achieve what you want in life is definitely something that people can experience as well. But it's really important to know that the stigma surrounding mental health and substance use disorder, it's based on the myths and the misinformation that's flooded our society. Hashtag fake news, basically. Recovery is possible, and everyone's recovery journey as an individual, um, or I'm sorry, is very individual like that person. It might look a little different. So really, one size does not fit all. Some people may need counseling, treatments, medications, following a program, or some, variation of that. But when a person feels supported and successful, their self-esteem and their emotional health will vastly, vastly improve. And if COVID-19 has done anything, it's really shined a light on how many people are really, really struggling. So it's important, again, like we talked about earlier, to really normalize the conversation surrounding mental health as well as substance use.
And then when you look at it from that standpoint, it would make sense because a lot of people don't have a support system and that support where they can lean on someone in a time of need. So it all makes sense that it's not just one person being affected, especially during COVID. Like there's a ton of people here, that have been affected by COVID because a lot of their support system they don't have. So
Mhm.
there's signs or symptoms parents can look for or see in their children if they're affected by mental health issues or substance use issues.
Yeah. So, so we already kind of talked about some of the signs and symptoms of substance use disorder, and some of these symptoms again can also reflect on different mental health conditions. So some of the signs and symptoms of, let's say, depression specifically, it can include persistent sadness, low mood, stress, anxiety, kind of having a low frustration tolerance, feelings of hopelessness, being withdrawn, and especially for well, really, it happens for everybody, but especially for younger children, they um, they might not be able to express those feelings in that way. But they might be able to express how they're feeling physically, because as we know, our feelings, thoughts, and behaviors and physical signs, it's all connected. So some of those physical signs can include just overall feeling very lethargic. There might be some fatigue, some insomnia. They might complain of a bellyache or have like digestive problems, headaches, changes in weight and appetite as well. And some anxiety symptoms can include a lot of similar symptoms that you're seeing, with depression, except for anxiety is typically internal and it's really your reaction to stress. But it kind of involves having that persistent feeling of nervousness that just it doesn't go away, and it actually interferes with how you live your life. And another difference also is that anxiety is constant, even if there's really no immediate threat nearby.
Mhm. Those, it's so interesting because they're so similar. I imagine, like, as a parent, watching your child, you're just like, and you know something's wrong, but you don't know specifically what, and you don't want to push, them to communicate, and you don't want to push to get them help, but you also don't want them to suffer in silence. So I can imagine how difficult it can be for a parent to just watch their child go through these symptoms and signs and feel kind of hopeless a lot of the times.
Well, absolutely, and also, as we mentioned before, the different behavioral health systems are very, very stressed right now. So, even if you do get to that point that you're like, okay, we really need to get some help, the wait can be, very, very challenging, and it can be lengthy too. Which is why we're also seeing, increases in visits to the emergency department. Because that immediate need is there, because sometimes by the time we get to the point that somebody needs help, it's been something that's building up and building up and building up, and you want to try to address it before it bursts, which honestly, you'll hear a lot about the need for self-care, which is huge. But one thing that a lot of people fail to recognize is that often self-care, when people start implementing it, it's almost too late because things have been building up, building up, building up. So going to get that massage or getting the nails done, you might start to feel a little bit better in that moment, but some of those things might have been festering for quite some time. So even though self-care is very important, it's very important to engage in it, make sure that it's a regular part of your day, so that it just becomes a natural thing to help keep those stress levels down a little bit more.
Last and final question. Do you have any suggestions for students or people suffering from mental health issues who are hesitant to seek help?
Okay, so um, again, it is important to try to engage in self-care. However, the big thing to remember is that if you're struggling to cope, or the symptoms of stress, anxiety, or depression just will not go away or even slightly improve, it might be time to really consider talking to a professional. More often than not, just having that space to talk to somebody can really be helpful just in itself. And seeking help really has many immediate and long term benefits, such as you might not feel that you're struggling alone anymore. Dealing with mental health issues or substance use, it can be very isolating experience. And seeking help really ensures that you can build a supportive community that really does understand what you're going through. And this community can offer helpful, but most importantly, appropriate guidance and advice. You can also build better relationships. Counseling especially, it'll empower you to reconnect with your loved ones, and you'll be able to build better, healthier relationships through clear, but more importantly, honest communication. And it can also help you to reduce your risk for other medical issues. Um, Studies have shown that poor mental health can also cause other medical issues. Your poor sleep or sleep disorders, obesity, digestive problems, and other illnesses. Again, they're all linked. We kind of touched on that a little bit earlier. Seeking professional help can teach you to help develop much healthier coping strategies, and it'll give that professional can help give you the coping tools and the strategies that you need, especially to be able to navigate really challenging situations. And your performance at work, school, just life in general can improve. Your quality of life will be improved. Getting help can assist you in strengthening your relationships, also meeting new friends, and you'll learn how to cope with those challenges. Not just the challenging situations that might happen every once in a while, but just even ones that arrive on a daily basis. And you'll also be able to discover what does and what does not work for you. And all of these things can really positively benefit your life in the long run, creating a healthy and happier you. It's really important to learn what your resources are that are available to you. You had mentioned earlier on that Baldwin Wallace has a lot of resources that are right there. So, whether those supports and resources are available through your school or your employer, your provider, just in the community, it's important to learn what they are. And There's also other ways to get help without ever leaving your home. We had talked about telehealth a little bit earlier, but for example, the Suicide and Crisis Lifeline at 988, you can call or text them. It's free, it's confidential, and they can connect you to resources, even if you're not feeling suicidal. So you can do this for yourself. You can do it for someone else that you're trying to help. You can also call 1-800-662-HELP. And that's a number from SAMHSA, which is the Substance Abuse and Mental Health Services Administration. They can offer resources as well. Um, learn the facts, because again, so much of the stigmas that we have in our society are from all the myths and miseducation that's out there. But also another thing to take into consideration is that, you know, if you're hesitant about seeking help, to kind of reframe it, what you've been doing isn't working, right? So maybe it's time to try something different.
You too.
Thanks. Bye bye.